So I just finished my first case today, and it was a capsular contracture patient who just wanted her implants out. So this poor person had had multiple attempts at salvaging her breast implants to try to prevent the capsular contracture from coming back, and it just kept coming back. And when I got in there, I saw why, because they just didn't do the right thing, in my opinion. So I'll tell you a little bit about what they did and then what I think the right thing to do is. So capsular contracture, for those of you that don't know, is when the scar tissue sac around your breast implant that your body forms becomes thick and abnormal, and when it's thick, it compresses the implant. So it starts out with the implant feeling a little firmer but looking normal, and it can progress all the way to your breast looking insane and then also having severe pain, which is what this patient had. So in general, capsular contractures happen for two reasons in my experience. So a ruptured silicone implant is reason number one, and then reason number two is biofilm, in particular with certain bacteria that we find swimming around the implant. Now, biofilms happen a lot in general with implants. That's been well documented, but it just seems like some people don't respond to them the way we wish they would, and they develop chronic inflammation and capsular contracture. So when you manage a capsular contracture, in my opinion, you should remove the entire capsule. And you should also check to make sure that there's not bacteria around the implant. Since a biofilm is a low-grade subclinical infection, I usually send Microgen, which is a PCR test, to look for bacteria because it's not very reliable to culture around the implant, unfortunately. And then when you reconstruct the breast, you want to use, obviously, a fresh, brand new implant, but you also want to treat the patient with antibiotics to manage potentially biofilm because you won't have answers for a few days. And then also use something to help minimize recurrence like dermal matrix, and I'm using a lot of Galaflex. So that's how I think you should treat contractures. So this patient had kind of all of the things done that I don't recommend. So first of all, she never had her capsules removed. There was multiple capsules in there, so they just kept creating what's called a neopocket. So they would basically create a new space for an implant when they went back in right over the old space. And so she just kept developing contractures. So there was like multiple pockets in there I had to remove today. They put betadine all around her implants, which is not what most of us do. So there was, a kind of large amount of brown liquid around both of her implants, which shouldn't be there. On one side, they kept using the same implant over and over again, which you just shouldn't do. And the reason I know this is because it's a very old implant, and she had a relatively recent surgery. So this is an old implant that should not have still been in there. And then also they didn't remove the capsule at some point, and they put a textured implant on one side instead to try to prevent recurrence without actually managing the problem. So she kind of had a lot of things done, but really nothing that, in my opinion, would have managed the problem. She could have lived many years with a soft breast and instead had the firm, painful breast that we're dealing with today.